Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate through March 30th, 2023, the last week of March 2023. And as we do the last week of every month, we're going to update the COVID pandemic and then also ask the question, are there any other outbreaks we should be paying attention to? In terms of COVID-19, I think it's no secret for the last year now, we have seen a pretty level amount of death in the country. We haven't seen the spikes that we saw in the first 2 years, running about 200 to 300 deaths a day. In terms of hospitalizations, the other pretty good metric that we use, again, fairly level, a few little spikes here and there, but nothing like what we saw before. Overall in our country, we've had 1,100,000 official deaths, probably more than that. That's about 250 deaths a day, about 10 times that number of hospitalizations a day. And at the current rate, it'll be the ninth leading cause of death in the United States. So it's not gone away by any means, but we're not seeing the kind of horrific spikes that we saw before. In terms of where in the world the deaths have been the greatest, this is deaths per million. You'll see that other than Peru, most of these are Eastern European countries, and then the United States down there at 15th. Within the United States, the death rates are here, deaths per million, largely in the South, with a few scattered numbers elsewhere. My state of Tennessee has a rate about 25% higher than the national rate, and there may be a couple of explanations for that. So how is COVID doing? I think many people are now saying we should think of COVID not necessarily as a pandemic, but as an endemic disease. That is one that is fairly stable in a country. It's not gone away. 250 deaths a day is quite serious. A top 10 cause of death is very serious. But we're not seeing the spikes we saw before. Will we again? No one knows. I think the current best thought is that we will probably see an annual vaccine, very much like we do with the flu, which is developed specifically to address whatever strain of COVID is circulating at that time. Well, what about other infectious diseases? Are there other outbreaks we should be paying attention to? Well, you'll recall a few months ago, we talked about bird flu, avian flu H5N1. It's still widespread in the United States and globally in wild birds. There are sporadic outbreaks in domesticated birds, occasional occurrence in mammals. Now, in the United States, most of the cases in mammals have been in the northern part of the country. Those silver diamonds here are red foxes. The purple circles are striped skunks. But you can see it's occurred in a variety of different mammals. And being mammals, it can also occur in humans. We've had one human case in the United States. There have been sporadic human cases in other countries, but no human-to-human transmission. But again, as long as the virus continues to circulate, there will be slight mutations, and one of those mutations could cause some changes in the transmissibility. The CDC currently classifies the public health risk as low. So while it's certainly something we want to keep following, it's not something we need to be particularly concerned with right now. But there is an outbreak in Africa that I think is worth paying attention to. That's Marburg virus outbreak. It never been reported in Tanzania or Equatorial Guinea before. There have been 8 cases and 5 deaths in Tanzania, 9 cases, 7 deaths in Equatorial Guinea, and probably 20 probable cases. For those of you that are interested, Tanzania is the big country in red, Equatorial Guinea is the smaller country. It's very similar in many ways to Ebola that we've talked about in the past. They're pretty confident that the virus comes from bats, but again, not absolutely sure. It's human-to-human transmission through blood and body fluids, very much like Ebola. And the symptoms early on are fairly difficult to distinguish from anything else: watery diarrhea, abdominal pain, nausea, vomiting. But then what happens, like Ebola, You get severe hemorrhagic bleeding manifestations about a week after onset. And again, bleeding from multiple sites, multiple areas. So the symptoms appear 2 to 21 days. It affects all parts of the body. It can be a very serious disease with a death rate of 50 to 88%, depending not just on the severity of the disease, but also on the availability of healthcare. There are lots of other outbreaks going on in the world that we need to keep paying attention to. But I think one thing we have to accept is we are going to see more infectious disease outbreaks in the coming years than we have seen historically for a variety of reasons. One is climate change. As things get warmer, insect distribution changes. There's flooding that can increase disease risk, for example, with cholera, and then changing in agricultural opportunities. Anything that drives people together drives people away from their traditional way of living. The social disruptions like in Ukraine, Haiti, international migration, again, anything that moves large numbers of people in together or makes them move away from their traditional homelands can cause outbreaks. And then overpopulation, urbanization, encroachment. I mean, the idea now with these cities of 20 million people or more, once an infectious disease gets in there, it's going to spread much more likely. So I think we have to all be ready for future outbreaks. But there's one more factor that I think is going to contribute that I really worry about, and that's misinformation and the loss of trust in science. The amount of misinformation, also known as lies, misrepresentations on the internet going around is going to be a major hurdle to overcome. Because if people don't believe in science, if they don't get vaccines, we're going to see outbreaks of vaccine preventable diseases. And when something does occur, if folks don't believe that they need to follow the advice of the World Health Organization or the Centers for Disease Control, we're going to get behind. And as we saw with COVID, once you get behind a disease, it's very difficult to catch up with it. So what's going on with COVID? I think we need to think of it as a chronic disease now in the United States. We'll know in the next 12 to 18 months if we're going to start seeing the spikes again. Right now, we don't know that. And are there other outbreaks we need to be paying attention to? Yes, obviously bird flu, but also this Marburg outbreak in sub-Saharan Africa. Please, as always, feel free to share these videos with anyone who might be interested. We're happy to add people to our mailing list. Thanks, as always, to Dara Young for editing, producing, adding captions, and posting this video. And if you have any questions about what I've said today or about any other evolving public health issue, please let me know. I look forward to hearing from you. So until next week, please be well.